Hello, I'm Dr. Sanjog Nikeva. I'm consultant interventional spine and pain physician and also the director of Jivisha Spine Pain and Regenerative Clinic. So today I wanted to discuss with you one case, and it is very close to my heart because we have struggled for about 3 to 4 months for solving this puzzle. And our patient was very cooperative with us. She followed all the instructions, and we have a lot of things to learn from this case basically. So that's why I wanted to share this case with you all. So I welcome madam. You can please tell us your introduction and then your journey, what happened to you, and how you reached our place.
Okay,
Just in short, whatever you want to say.
I'm Mrs. Rita Mathur, and I have one thing I'm very particular about to insist in saying that Shivji has guided me right through, taken my fingers, and he's guided me all through, right up to him, through this whole journey of this cancer. He helped me diagnose it very fast. It was a breast cancer and a thyroid cancer, and we had a very good surgeon. Everything was fine, and but then suddenly sometimes some things happen after post surgery which you don't realize. I thought everything is ठीक हो गया, fine. But then I started getting severe pain, which was very difficult to figure out what exactly is the problem. तो ये हो रहा था कि ये करना वो करना, तो समझ में नहीं आ रहा था. Then like I said, Keshav ji brought me to Dr. Sab here, and one thing, I want to definitely make very strong this thing that this doctor here, he listens to you. He's a very caring person. He understands, he empathizes, and anything that I told him, and he made so much of effort. इतनी मेहनत करी उन्होंने हमारे साथ, इतनी मेहनत करी है कि finally at the in the this thing I told him कि डॉक्टर साहब, वन थिंग आई प्रॉमिस यू कि ये पेशेंट को आप पूरा ठीक करके ही छोड़ेंगे. आई नो दैट इट वाज आवर पैक्ट, एंड हमारा पैक्ट वो तो था, लेकिन सुनिए देखिए मेहनत इनकी है, इन्होंने इतनी मेहनत करी. ऑल कुडूज, ऑल दिस गोस टू हिम.
That's very nice of you to say, madam. But we'll give you our listeners a bit of idea what exactly you went through. So you had a breast surgery,
Yes.
and what she suffered from is called as post mastectomy pain syndrome. So whenever if we are undergoing a mastectomy, so we are removing a breast tissue, okay, from your body. So there are so many nerves which are there which supply this part, right? And there is a lot of muscular tissue that is sacrificed or that is injured when you are doing these surgeries. Then there is a lot of inflammation that happens, post injury inflammation. So because of all these things, so there is nerve injury, there is cutting of nerves, there is local injury to the muscles, to other tissues. Okay, so because of this local injury, there is what we have discussed in earlier videos, there is nociceptive pain. And because of these nerve injuries, there is formation of what is called as neuromas, and these neuromas lead to neuropathic pain. Okay, so there is a mixture of nociceptive pain, neuropathic pain, and when this becomes chronic, there is another component of pain which is called as sympathetic pain. Okay, so this was her condition when she came to us. She was suffering from a mix of nociceptive, neuropathic, and sympathetic pain. So it becomes very important to diagnose this condition at the earliest and start treatment at the earliest, because it is a long process. We have to treat each kind of pain one by one and then try to reduce the suffering of the patient one by one. So can you just tell us in brief what all things you underwent, like any injections, medications, how was the journey, how you were guided here?
Yeah, it was a multi-pronged effort. We also did needling.
Yes.
We did through ultrasound. He made sure where exactly the problems is. He first diagnosed कितना कहाँ पे क्या सूझ रहा है, क्या problem हो रही है, and then the amount of injections and the things that he injected, आगे भी पीछे भी, एक बार तो 2-2 3-3 घंटे लगा के इन्होंने मेहनत करी है to get it in the right spot. all the details so many
Yes.
about him, the amount of research that he did. There was another some कहीं और का study, he studied that and then he showed me कि देखो ऐसे ऐसे होता है. All these pains are terrible. Especially this neuropathic pain na, is the worst pain. It's what we call labor pains, dying pains, but neuropathic pains are they're worse than that, 10 times worse. And he also gave me a lot of medication otherwise. And then finally we also went in through opioid this
Yes.
painkillers and medications.
Yes.
So there was a lot of medication, eating, injecting, a lot, in every way that he could help me out. He did it that way. And finally, at the end, after I think about 3 months, I felt कि maybe I think now I can stop the medication because मुझे लग रहा है कि अब ये ठीक हो जाएगा. But at that time I was in Australia. But then I said I'll come back and I do it. I came back, I stopped the medication without informing him. And I was feeling fine. Then afterwards, definitely I did have withdrawal symptoms, but fine. I mean, I was very sure that I've overcome it, so I don't want to get into another line of bimari or more.
Yes.
But it's really good. Everything. We also went to physiotherapy also. Don't forget that
Yes.
also.
Yes. So for her case, we had a group of medications. Then we started with physiotherapy because releasing those tight muscles is very important. We used something called as MIPSI, that is minimally invasive pain and spine interventions. That is the injections like PEC1, PEC2 injections, serratus anterior plane block. For sympathetic pain, we even did a paravertebral block. So there were combinations of injections that were done and combination of medications that were used. Ultimately, what we got success with was a new group of medications which acted on the cannabinoid receptors. Okay, so I wanted to tell this because uh, this is a new group of drugs which is acting through different mechanisms. She was getting relief with other medications, but not that much that we can stop the medications. So now when we introduce this group of medications, then definitely it helped her a lot. So actually the moral or the take home message that we get from this case is, first is the attitude. The positive attitude of patient is a must for treating any kind of such chronic pain conditions. If patient it herself or himself is very negative about his or her condition, then it becomes very difficult for doctors to treat her. She was very, very positive. Even if she was in so much of pain, she was very positive all throughout the journey of her treatment. Second is proper follow-ups. So I have seen many patients who just jump from one doctor to another. If they're not getting relief within 1 or 2 weeks from one doctor, they are jumping to other doctors. Here we have tried so many things. So if you give proper time, give chance to doctors, they can try multiple kind of things that can be done for the case. If you jump from one doctor to other doctor, then it becomes very difficult. You have to, every doctor starts from the zero once again, and then you don't get.
I'd like to add on bharosa.
Yes.
And faith is very important.
Yes.
मुझे पूरा भरोसा था, and that's why हम लोग की डील थी कि हम लोग
Yes.
ठीक होके ही निकलेंगे. नहीं, पूरा भरोसा, पूरी faith थी मुझे इनमें. He's a type of person who inspires faith in you. He's really good at his work.
And lastly, the third point that is important is try everything that is possible. Again, if you give proper chance to doctors, they will try everything. So ultimately we got success with a new group of drugs here. If she would have left us in 1 month, we could not have reached till this stage and she would not have got relief. So again, these 3 points are the take home messages. Positive attitude, definitely. Proper follow-ups, give chance to your doctors to do proper treatment and try to do whatever is possible to reduce that pain. Don't just tell doctors कि ये इंजेक्शन एक इंजेक्शन से हो गया, बस इससे ही करो वैसे ही करो, नहीं. The chronic pain treatment requires a multimodal management. Multiple things have to be tried, and then only you will get success. So any last comments, madam, you want to just?
with all his multi-pronged efforts, definitely बहुत फर्क पड़ा था. And उससे थोड़ा सा जैसे ये कह रहे definitely one thing I would also definitely like to add कि जैसे अब हम फिजियोथेरेपी कर रहे हैं, उन्होंने बोला हाथ यूं करो, तो एक्सरसाइज के हिसाब से आपने हाथ यूं किया तो that's good, but then incorporate it into your lifestyle, then it makes a difference. अरे किचन में आप और ऊपर कर करो so that और हाथ ऊपर बढ़े, because the idea that's the idea, when you incorporate it in your life then it makes a difference. This is that also one take home I feel कि
Yes,
this has to be
yes,
also
yes. Again, it comes in positive attitude. Only positive people try to incorporate all those things in your daily lives.
नहीं जब बहुत कोशिश करी हमने, इनसे पूछा, अपनी तरफ से भी हमने पूछा कि हम स्विमिंग करें, he said yes, and स्विमिंग करके इतना फर्क पड़ा,
Yes,
it made so much of a difference. But then it was a मिक्सिंग है ना,
yes,
अपने
yes,
आप से कोई एक जना नहीं कर सकता है,
yes,
दोनों को मिलके we gelled together very well, I think.
yes, yes. And I have to say that you are one of my favorite patients.
Thank you. You are one of my favorite doctors. He's a painless doctor, definitely.
Thank you, madam. Hope this talk will help some of our patients to get know about this
Yes.
post mastectomy pain syndrome, and also an attitude that one should have if they want to get the proper treatment. So,
Yes.
thank you.